Welcome to the video. Test your nursing knowledge and pass your NCLEX exam. This covers everything from medical surgical nursing to maternity. Now, let's get started. Which of the following nursing interventions is most important for a 45-year-old woman with rheumatoid arthritis? 1. Provide support to flexed joints with pillows and pads. 2. Position her on her abdomen several times a day. 3. Massage the inflamed joints with creams and oils. 4. Assist her with heat application and ROM exercises. The correct answer is 4. Reduces swelling, increases circulation, diminishes stiffness while preserving joint mobility. A non-stress test is scheduled for a client at 34 weeks gestation who developed hypertension, periorbital edema, and proteinuria. Which of the following nursing actions should be included in the care plan in order to best prepare the client for the diagnostic test? 1. Start an intravenous line for an oxytocin infusion. 2. Obtain a signed consent prior to the procedure. 3. Instruct client to push a button when she feels fetal movement. 4. Attach a spiral electrode to the fetal head. The correct answer is 3. Non-stress test is a non-invasive test to evaluate the response of the fetal heart rate to the stress of fetal movement. Response will be reflected on the fetal monitor. A client is in cardiogenic shock after a myocardial infarction (MI). Which of the following is a correctly stated nursing diagnosis for this client? 1. Activity intolerance, related to impaired oxygen transport. 2. Altered tissue perfusion related to decreased heart pumping action. 3. Altered cardiac output related to cardiac ischemia. 4. Potential fluid volume deficit related to decreased intake. The correct answer is 2. Correctly stated, appropriate nursing diagnosis. The client is exhibiting symptoms of myxedema. The nursing assessment should reveal 1. Increased pulse rate. 2. Decreased temperature. 3. Fine tremors. 4. Increased radioactive iodine uptake level. The correct answer is 2. With myxedema there is a slowing of all body functions. The physician orders sucralfate Carafate 1 gram PO bid for a 56-year-old woman taking digoxin Lanoxin 0.25 mg QD. The woman asks the nurse if she can take both pills together with her breakfast so she doesn't forget to take them. The nurse should advise the woman to 1. Take the Carafate and Lanoxin before breakfast. 2. Take the Lanoxin 1 hour before breakfast and the Carafate 1 hour after breakfast. 3. Take the Carafate 1 hour before breakfast and the Lanoxin 1 hour after breakfast. 4. Take the Carafate and the Lanoxin after breakfast. The correct answer is 3. Carafate. Best results on empty stomach. Medications should be separated by 2 hours for maximum absorption. In pre-admission planning with a client who is to have a renal transplant, the client should be educated by the nurse regarding the need to 1. Remind family and friends that there is restricted visiting for at least 72 hours postoperatively. 2. Arrange all live plants received postoperatively in one section of the room. 3. Continue intermittent peritoneal dialysis for 3 months following surgery. 4. Limit consumption of sodium-free liquids for 1 year postoperatively. The correct answer is 1. Transplant clients require protective isolation following surgery. When administering antipsychotic medications parenterally, the nurse should take which of the following actions? 1. Monitor the client's blood pressure while sitting and standing before and after each dose is given. 2. Caution the client not to drink or operate machinery that requires mental alertness for safety. 3. Have an emergency cart available in case of an adverse reaction. 4. Reassure the client that side effects are only temporary. The correct answer is 1. Primary concern with postural hypotension caused by medication and preventing an injury from a fall. Monitoring vital signs will provide data to address this concern. A client is receiving total parenteral nutrition (TPN). To determine the client's tolerance of this treatment, the nurse should assess for which of the following? 1. A significant increase in pulse rate. 2. A decrease in diastolic blood pressure. 3. Temperature in excess of 98.6 degrees Fahrenheit, 37 degrees Celsius. 4. Urine output of at least 30 cc per hour. The correct answer is 4. If the client is being properly hydrated with hypertonic IV such as TPN, urine output needs to be at least 30 cc per hour. Other nursing action includes assessment of blood glucose levels. The visiting nurse is teaching a client how to use esophageal speech following a total laryngectomy. Which of the following actions, if performed by the client, indicates that the teaching was effective? 1. The client swallows air, and then eructates it while forming words with his mouth. 2. The client places a battery-powered device against the side of his neck. 3. The client places a finger over the tracheostomy, forcing air up through the vocal cords. 4. The client covers the stoma in the tracheoesophageal fistula and moves his lips. The correct answer is 1. Describes esophageal speech. The nurse is caring for a client who has just returned to his room after a scleral buckling procedure to repair a detached retina was completed. Which of the following is the most important nursing action? 1. Remove reading material to decrease eye strain. 2. Ask the client if he is nauseous. 3. Assess color of drainage from the affected eye. 4. Maintain sterility during Q3H saline eye irrigations. The correct answer is 2. Assessment is important to prevent nausea and vomiting, would increase intraocular pressure, could cause damage to area repaired. A 4-month-old infant is admitted to the pediatric intensive care unit with a temperature of 105 degrees Fahrenheit (40.5 degrees Celsius). The infant is irritable, and the nurse observes nuchal rigidity. Which assessment finding would indicate an increase in intracranial pressure? 1. Positive Babinski. 2. High-pitched cry. 3. Bulging posterior fontanelle. 4. Pinpoint pupils. The correct answer is 2. High-pitched cry is one of the first signs of an increase in the intracranial pressure in infants. A client comes to the health clinic and tells the nurse that he has been taking acetaminophen, aspirin-free Excedrin, daily for 5 months. The nurse would be most concerned by which of the following lab results? 1. AST SGOT 30 UL, ALT SGPT 27 UL. 2. HGB 16.2 grams per deciliter, HCT 46%. 3. WBC 7000 per cubic millimeter. 4. BUN 9 milligrams per deciliter. The correct answer is 1. Can cause liver damage. Normal AST, formerly SGOT, 8 to 20 UL. Normal ALT, formerly SGPT, 8 to 20 UL. The nurse is teaching a well baby class to a group of parents with toddlers. The nurse should encourage the parents to 1. Have their children exercise daily. 2. Use a playpen whenever possible. 3. Provide a safe play area for their children. 4. Teach their children non-competitive activities. The correct answer is 3. Safety is fundamental issue with this age group, they are exploratory in their play. A 2-year-old is admitted to the pediatric unit with numerous bruises, a fractured left humerus, and several lacerations with unexplained origin. The nurse would identify which of the following as a priority nursing action. 1. Report the findings to the Child Protection Agency. 2. Share this information only with other health care professionals. 3. Document this information in the chart. 4. Share the information with the pediatric social worker. The correct answer is 1. Any suspicion of child abuse should be reported to the Child Protection Agency. A 72-year-old patient is admitted to the hospital for treatment of a fractured femur. The patient's wife tells the nurse that he has become very hard of hearing. The nurse might expect the patient to exhibit which of the following characteristics. 1. The patient prefers to be left alone. 2. The patient appears suspicious of strangers. 3. The patient communicates best in writing. 4. The patient's speech is difficult to understand. The correct answer is 2. Suspiciousness results from interference with communication. The nurse is caring for a client with type 1 diabetes mellitus (IDDM). The client is receiving nasal oxygen at 4 L per minute. The student nurse reports that the client has pulled out his nasogastric tube and is picking at this bed covers. The client's BP is 150/90ths and pulse is 90. Which of the following actions by the nurse is most appropriate? 1. Obtain a pulse oximetry reading. 2. Apply soft wrist restraints. 3. Reorient the client to person and place. 4. Determine the client's blood glucose level. The correct answer is 1. Assessment. Symptoms indicate reduced oxygen levels. To maintain client safety, the nurse should have which of the following equipment readily available when inserting an Ewald tube? 1. Suction equipment. 2. Blood pressure cuff. 3. Levine tube. 4. Emesis basin. The correct answer is 1. Ewald tube is a large orogastric tube designed for rapid lavage. Insertion often causes gagging and vomiting. Suction equipment must be immediately available to reduce the risk of aspiration. In planning anticipatory guidance for parents of a beginning school-aged child, it is most important for the nurse to include which of the following? 1. Teach the child to read and write. 2. Teach the child sex education at home. 3. Give the child responsibility around the house. 4. Expect stormy behavior. The correct answer is 3. Giving children responsibilities allows them to develop feelings of competence and self-esteem through their industry. That's it with this video. Check out the website for more free nursing test bank questions. Thank you for watching.